Here in Texas, the new year is accompanied by plenty of coughs and sniffles. You've probably heard them around your home or office. The latest report from the CDC shows there are very high levels right now of respiratory illness in our state, and that includes things like COVID, RSV, and the flu.
We would like to hone in this morning on influenza, since data from the feds also shows a sharp increase in the number of emergency room visits linked to that across the country. So joining us today is Andrea Walker, who is a pharmacist here in Austin. Andrea, thanks so much for joining us. We appreciate it.
Thank you for having me.
It seems like it's a busy time for a lot of medical professionals at the moment. So what can you tell us about whether flu cases are on the rise here in our area?
They are actually on the rise. The Texas Department of Health Services showing that Region 7, which Austin is included in, is having an increase in flu based on the number of ER visits with confirmed cases.
We know that this is a time where we're coming out of spending a lot of time with family and friends, big gatherings for the holidays. How do you think that is contributing to this uptick we're seeing?
Oh, huge. So the flu is a very contagious respiratory illness that's spread through the air and through contaminated surfaces. A person can actually start spreading the virus one day before they even show symptoms, and for 5 to 7 days after those symptoms appear.
And now, ahead of the arrival of flu season, we always get those reminders to get our annual flu shot. Fortunately, I was able to do that a few months ago. But what can you tell us about how much that offers protections from people from getting seriously sick? And what would you also say to those who may not have gotten that shot just yet?
Right, so yeah, the flu shot does actually help stimulate your body to produce antibodies that protect you against the virus. So it's really important to get it, but we do need to remember that it takes 2 weeks for your body to develop that full immunity. So let's get it sooner rather than later, and it's not too late to get it now.
Okay, so what do you recommend, particularly what age groups need to be receiving those flu vaccines? Are there certain demographics who really should take that warning even more seriously?
For sure, yeah. So the CDC recommends anybody over the age of 6 months to get a flu vaccine. And those who have like chronic conditions definitely need to consider it.
And we just addressed this a little bit a moment ago, but I think it's important for people out there. Some might be skeptical of getting the flu shot. How would you address some of those concerns for people and advise them about the protections it offers?
Right, so I would recommend that, they discuss with me why they have the apprehension over getting the vaccine, maybe like debunk some of their myths that they have associated with it, because I do think it is really important to get a vaccine because it does provide protection, and flu can cause complications that, are not really pleasant sometimes. And when you get a flu vaccine, it helps protect those that can't. So it's really important.
Talk to us about, if you can, working at Randall's stores as you have across Texas. It's probably a little different than making that doctor's appointment. I know a lot of people have that anxiety about going to the doctor. It might be a little easier buy-in to walk into your friendly Randall's. What kind of interactions do you typically have with the pharmacies in the stores?
Oh yeah, well, so people can just walk in or they can make an appointment for a flu shot. It's so fast and efficient. Basically, you fill out a consent form, whether you do it online or in person, and it's done. It's taken care of for you. We bill your insurance, you're in and out, and you get a 10% off your grocery coupon.
Oh, wow.
Yeah.
Okay, so there's a benefit
There
even more
is.
to that.
Get yourself a treat after to say good job for getting that shot.
Correct. All right, well, Andrea Walker, we appreciate you being with us here today, and hopefully this helps people out there and prevent some illness from spreading out as well.
That would be really great. We definitely want to see those number of cases going down.
Yeah, for sure. All right, thank you again, and we appreciate that, and we'll send it to break right now, and we'll be back after this.